CHC is a partnership of community organisations that have come together to really try and address the really complicated social issues that affect the health of the community.
The social issues that the CHC is focusing on are very complex. Issues of mental health, substance abuse, homelessness are all areas that impact many of our citizens, but also require a lot of services.
It's now becoming recognized that no single organization can address these types of issues on their own.
It's collaborative. That's the key, is to bring people together so there's no overlap. I'm doing this, you're doing that, well, let's do it together. You know, it's a pretty cool situation.
It allows, I think, for the first time in a meaningful way, a lot of these different agencies and a lot of these different people to be able to talk to each other.
There's so many wonderful organizations that exist in the Chilliwack area, so many people and places that are trying so hard within their own mandates to address issues, all kind of in isolation.
We want a caring, collaborative community that when we recognize that there's a local need, whether it be mental health, healthy lifestyles, public housing, or public safety, that we need to do it together.
We can do things better together than any one of us can do individually as either an organization or as a government group. And then we're going to have greater impact. And at the end of the day, the citizens of Chilliwack will benefit.
The grand design is really for us to know exactly what we have available, to make sure that we're focusing and supporting people to get to those services. And if there are any gaps, that we as a collective find a solution to what those gaps might be.
One of the most important things that the CHC does is to allow sharing of information and establishing working relationships between different groups.
If you walk in with a mental health concern and go into the wrong building, well, we're educated now to refer, to say, hey, let us help you with this, find the right referral and not just leave you stranded saying you got to move on, but instead contact that other referral, give a warm handoff, make sure they're not empty-handed so that way it's easier for them to access the service they need.
The more connected we are, the more we can create that kind of small town feel of people meaning something to each other.
A lot of times you find that people are struggling with other areas in their life, and that's maybe why they're having a hard time finding employment. So being a part of the CHC has really broadened my whole office's ability to learn about more services that are available to assist these people with those underlying issues.
It encourages my organisation to think beyond healthcare services.
The needs of this community are similar to the needs in any community across Canada. The homeless population, the drug addicted, the mentally ill, the folks who are falling through the cracks. We need the CHC to continue working together to address those needs because the need is not going away.
We're a growing community. And as we grow, it's easy to have our own little areas, but the bigger we get, the more we need to come together to discuss those serious issues.
We can no longer be witnesses to what's going on. It's up to us as community leaders or service providers to get in there and start coming up with the solutions.
Let's not wait till problems develop. Let's do something proactively to make our community better.